Hi guys, I'm back. Sorry for the hiatus between videos. At this point, I've only been recording on the days I've had doctor's appointments or follow-ups. And well, today's one of those days. I had a follow-up this morning. And I just want to talk to you guys about how that went, how things are looking, what I've been cleared for. So I have been cleared to go back to the gym officially. I've been cleared for cardio, light cardio, and to go back to weights. But I've been advised to go back and start at half of what I was doing before surgery. So if I was lifting 30-pound dumbbells, to start with the 15-pound dumbbells and work my way up from there. Super excited about that. I've been advised to avoid anything that involves jumping for a few more weeks, unless I am able to support, like with my hands, to make sure that my breasts don't bounce too much, because they are still forming that scar tissue under the bottom. And that scar tissue will basically determine where the breast and the implants sit for a lot of the time for like the duration of you having your implants in. I've also been cleared to sleep on my side, which I've been doing for the past few nights. And it's weird because I haven't been sleeping on my side at all. So it took me a while to get comfortable and to like remember where to like put my hands when I'm laying down. So that's been interesting within itself. I today was told when I go to my next appointment, which will be May 27th, that they will take my tapes off completely, and I'm able to start what's called New Gel. New Gel, it's a scar management solution. This little guy here is actually a sample of the new gel itself. So you can kind of see it's a silicone sheath is what they're called, that you put on. And the instructions here say you can peel off, release liner, and apply directly on scar. Wear for a minimum of 6 hours per day, and reusable for up to 4 weeks. Simply hand wash with water and mild soap, rinse well, air dry, and reapply. So that's nice. And this was actually recommended by Dr. Rodgers and by her nurse, Kate, because of the fact that they come pre-cut to the size and shape of what my scar will be, which was a lollipop lift. Had I got an anchor lift where they go around the areola down and into the crease, I would be using this one here. Or if I had gotten a donut lift where just around the areola, I'd be using this one here. So it's nice because I can just buy the shape that I need instead of buying just like a big square of like a silicone sheathing like skin scar treatment and having to cut out little like individual pieces, which is how I have to cut my tape for the time being. So I got cleared, and I will be purchasing some of these before my next appointment to make sure I have them when I'm cleared to use them. And other than that, there's not really much to update on. I'm still doing my massaging 3 times a day I do about 15 to 20 seconds. Let's adjust this. So I do underneath and push the implant up for 15 to 20 seconds, and then in as well for 15 to 20 seconds. And doing that, it helps to break up what may be forming as scar tissue on the top and on the side of the implant to help it to fall a little bit better and a little bit more natural. I'm doing that, and everything is fine. I haven't really had much pain, and everything has really been fantastic. I will change so you guys can see how my development and how my tape looks, and I'll be right back with you guys. Alright, so I'm back to show you guys how they're looking. And yes, I am using post-it notes to cover my nipples. I've had a few requests to show my nipples, but there's not really any point to doing it. For one, they haven't changed. Like color, color's fine. I've had a slight change in sensation, but outside of that, the healing process is fine. And for two, I'm not comfortable showing my nipples on YouTube. So if that is your only comment or your only request, You can feel free to leave them, obviously, but just know that's not going to happen. So with that being said, I will show you guys the progress up to this point. So I use the Post-it notes so you guys can see how they're falling without my hands in the way. And so this is, so where my tape is now, there's nothing here. This is just to keep the bottom piece of tape down. But where my tape is here and then up and around, that's also where my scar treatment will sit. But you can see that they're starting to look a lot more natural, that they've fallen quite a bit. I'll show you guys the implants, they move. You can see it come all the way up into like, and it's weird because you can, like, if you watch here, you can see the implant almost come up into my tattoo. And same thing with this one. And then you bring them in. And yes, there is a little bit of rippling on this implant here. I'm not concerned about it. Nothing is perfect. I still love them, but that should kind of smooth out and break up as I continue to massage my implants. But that's what they look like. And that is my update video. And as always, if you guys have any questions, please feel free to leave them in the comment box below. If you're new to my channel, thank you for watching. I hope it's been informative. Don't forget to like and subscribe. And if you have any ideas for other videos, like if you want me to do makeup videos or day in the life, I do have an actual job. If you guys want to know anything about that, please let me know, and I'd be happy to show you guys more of my life, I guess is the best way to put that. So this is my update. My next appointment is May 27th, but I think I'm going to go ahead and do a day in the life or something like that between now and then. So that's all I have for you guys today. Thank you guys so much for watching and for your support and all your kind words. It really does mean a lot to me. And I will see you guys here in a few weeks. Bye, guys.